Morning, everyone. My name is Melissa Zambri, and I'm an attorney with Barclay Damon. We've had the pleasure of representing Flips and Grin for quite some time. And today, I want to welcome you and thank you for listening to this. This is compliance training, which is required now on an annual basis. It was always best practice that it be done annually, but now it's required on an annual basis. So we wanted to take some time to go over some things related to compliance, the importance of compliance, how we do things here at Flips or Grin, depending on which side of the house you work on. Maybe you work for both. So we want to, talk about some things that are extremely important here in the healthcare field. Compliance was always something that was very important, but over obviously the last many years, for those of you who have been in the healthcare industry for a while, it's become quite a bit more important. And so, why do we have a corporate compliance plan or a program besides the fact that it's required? Why do we have that? Well, we're trying to follow all of the federal, state, local laws, regulations that apply to us. We also have a lot of government contracts, and we've taken a lot of government money over the years. And obviously, there are requirements that we have to follow when we have those government contracts. And then to the extent that we participate in other public programs, to the extent, of course, that Grin receives Medicaid money, that all comes into play because there are requirements we need to follow there. But really, at the end of the day, what we're trying to do is act with honesty and integrity. We're trying to meet high ethical and professional standards because we care very, very much about the reputation in the community of our organization and of all of you who work with the organization. So we have a compliance plan, which is the actual documents that kind of talk about how we're going to comply with all of these rules, laws, and regulations. Our program, our compliance program, is the implementation of that plan. And then what we're trying to follow is these ideas of compliance standards. And that's all of these laws and rules and regulations and contract requirements. And those all of those things together can be rather confusing because they come from a variety of different places. Many of you at Grin know that there are DOH standards that we have to follow, that we sometimes follow, and sometimes they're in a memo form or put up on their website. So we have to keep all of those things in mind as we're trying to comply. We want to comply for a lot of reasons. One, it's the right thing to do, but also it provides stability and funding. Many times when you do something wrong in a government contract, or at least that's the perception that you did it wrong, you didn't maintain the appropriate documentation. On the Medicaid side, when they're looking at your documentation, they can try to recoup funds that they've already paid you. And this could be very difficult. As many of you know, when you get paid, you don't anticipate that somebody's going to try to take your paycheck back. You don't anticipate that sometimes they can go back 6 years. 6 years from now, somebody can take a look at how you performed your job 6 years ago and decide that they want the money back. In these cases, they can do that. And so we're trying to uncover what are the mistakes or what are not following our best practices. What are we doing that we could do better before someone comes and takes a look at us so that we can correct things as we go. We can do things better every day. We also want to obviously be able to continue our mission and continue our good work in the community. And so if we have to pay money back, then that can affect the delivery of future services or our continued operations. And we want to also make sure that we have a good relationship with DOH and others that help to fund us and fund our good work. Looking at how we've performed in the past, be it a contract or our billings in Grin, looking at that happens for a lot of different reasons, but sometimes it's just our turn to get looked at. And so while certainly our billings over on the Grin side or complaints or people saying that they have concerns over the way we're doing things could come into play, many times it's just time to look at those services. So just because we're being audited or reviewed doesn't mean necessarily that we're doing anything wrong. It just means for whatever reason, they may be interested in that contract or interested in those services. And so we want to make sure that we're prepared for those things. Obviously, we're trying to prevent fraud, waste, and abuse, and I'll talk about those terms and how they're used. We're trying to detect any concerns that we have before we make the same mistake over and over again. And we want to respond swiftly to compliance concerns and make sure that we handle them appropriately. I do want to say there's a lot of use of the term fraud in the healthcare industry, and fraud certainly still happens in the healthcare industry without a doubt. but fraud is an intentional action. So when we're talking about fraud, we're talking about somebody doing something to misrepresent and fool, if you will, someone, thinking that they did something appropriate to bill or get some grant funding, when really it was not appropriate, or what they said was untrue. And so that's a very high standard when somebody's committing fraud, because they intentionally mean to be doing it. Waste is overutilization, i.e., someone really doesn't need a service, but they go to get it and somebody pays for it. So many times you see this where somebody continues to receive the same services and perhaps they didn't really need them, or they weren't really improving on those services, yet they can continue to receive them and bill them. So that's when they say waste, what they're talking about. And then abuse is really almost raises to a higher level of standard than even waste. And, in all honesty, I'd say one of the big quality of care billing issues that kind of brought this idea to light is there was a New York City hospital that amputated the wrong leg. And if any of you have received surgery and somebody marked you with a pen, that's what they're trying to avoid. So amputated the wrong leg, then amputated the right leg, and then had to reconstruct the wrong leg and billed Medicaid for all of it. And when Medicaid found this out, they said, something, we shouldn't be paying for this. And so when we talk about those types of things and we try to bring in medical necessity and we try to bring in standards of care and we try to bring in quality, this is what we're talking about, because just as you don't want to pay for services that you consider to be subpar, neither does the government. So we have a compliance program. We've had a compliance program for a very long time. It was revised this year because there were changes made for compliance, but we take a look at it every year. And it has written policies, procedures, a compliance officer, committee, training and education, very important on an annual basis, lines of communication, disciplinary standards, auditing and monitoring, and then responding to compliance issues. We are required to take a look at compliance risk areas. Billings, payments, makes sense. I just mentioned them. Ordered services, if something needs an authorization or an order, making sure that's in place. I mentioned medical necessity and quality. The governing body receives a lot of information about our compliance activities. Mandatory reporting, an opportunity for you to report concerns. Credentialing, if somebody needs a certain training or a certain education, making sure they have that. And then our contractors are required to follow our compliance plan. And then this interesting idea of other risk areas that we should know about. So those of you who work at FLPPS, those of you who work at GRIN, maybe where our risk areas are. Some of the things that maybe it's a struggle for us to do as best as we can at. And so what we want you to do is make sure you raise those issues with us, because that's what we should be looking at internally. So making sure that we're doing our own internal audits, or if you are part of an audit team that responds to an audit, that we become aware of issues, that we then take a look at them internally to address them. OMIG has an audit process, the Medicaid of the Inspector General, and they have a situation where they can come in and they can audit, right? The Office of the Medicaid Inspector General can audit, and they come in and they'll do an entrance conference where they'll sit down with everyone and they'll talk about what they're going to look at. And then they'll pull a sample of our records. And then they'll take a look at our records against our billing, and then they'll produce a draft audit report. They can statistically sample in that, which means they can take a small sample of our records and take our error rate and multiply it by all of our billings. So what's important there is, if you are on the GRIN side of the house where we're billing for specific claims, sometimes we would rather know, actually all the time, we would rather know when we have an issue so that we can make a determination as to what to do with that issue. Sometimes we will pay money back to Medicaid. And that's advantageous to us for a number of reasons. It's the right thing to do, but also it gets that sample out of our potential sample, and it gets that claim out of our review. So what we want to do is we want to catch things early so we can fix them, and that becomes very important. There are OMIG audit protocols. So the Office of the Medicaid Inspector General has audit protocols on their website for all different types of services. And so you can go on their website and see, well, what are they looking at in a specific area? And that's instructive to us, because then we can look at it and we can know what they're going to look for if they come in. When we talk about health home providers, for those of you who deal in this field, you're not surprised to see that they're looking for the documentation and the record. They're looking for an assessment. They're looking for a consent. They're making sure that we're not duplicate billing services. They're looking for eligibility. They're looking for a care plan. They're looking to make sure that we identify people as lost to service, or that we're doing our outreach and engagement billing appropriately, or that we're documenting our progressive outreach. If any of these things that are required, the face-to-face assessment, the documentation of these things is missing, it's their position that perhaps we should not have been paid for the service. So they can compare our billings to what we're paid, our contract requirements to our funding, and they can, in certain instances, come back and say, we shouldn't have paid you that. So with this kind of in play, we want to make sure that we're doing everything as well as we can to kind of combat that, if you will, in advance. It's like preventive medicine. And they can come in and take a look at our compliance plan and talk to staff and board and look at our culture and, review the implementation of the plan. And sometimes they can stay on site for a week. And we also have a responsibility to report when we have money that maybe we don't have a right to. So sometimes we do return money, we self-disclose, we pay money back. And that is all part of what we do as a healthcare provider. There are penalties attached if we don't do that, right? If we know we have money that we should pay back and we don't pay back. So there are criminal penalties, there's other penalties, and then there's this idea of the False Claims Act. And what we want to be careful of is that we don't make the same mistake over and over and over and over and over again, because when we do that, we end up in a situation where they could argue there really was a little bit of intent there because we were turning a blind eye. If we had a really good compliance program, we would catch these things. And so sometimes they prove knowingly, as you see, the False Claims Act also has, what we call the legal profession mens rea, right? An intent to it. So it's knowingly presenting a false claim to the government for payment. And so when we look at this, what they will do sometimes, they will say, something, if you do something over and over again, it starts to look like you're doing it on purpose. I often use the example when my children were younger. My son's foot grew from a size 7 to a size 12 in 1 year, and his feet were very, very large that year, and he had the rest of his body hadn't grown, and it was very, very awkward. So he seemed to be tripping his sister a lot that year. The first few times I thought to myself, oh, it's really hard to have Ronald McDonald feet, and it must be hard to know where to put your feet when they're so big and they used to not be so big, and that must take time to grow into your body. But by the 7th or 8th or 9th time that somebody trips, you start to think that somebody's sticking their foot out intentionally to trip them. That's the way they look at claims sometimes. You can make the mistake. Anybody can make a mistake. But when you start to have repetitive mistakes over and over and nobody catches it, or somebody does catch it and we don't fix it, then they start to wonder, well, is this really intentional? And there are penalties to the False Claims Act, and the state gave themselves a little bit of a raise. And then there's also civil monetary penalties for false claims, but also for violating kickback legislation. You may know that in healthcare, you cannot pay someone for a referral. That's perfectly appropriate with your Toyota dealer, your car dealer. You send someone over to get a car, they send you a gift card or a check or something like that, but you can't do that in healthcare. We also can't contract with people who are excluded from federal healthcare programs. We check people on a monthly basis to make sure that they are not excluded. And we also can't induce people to come to us. We can't give people free gifts. In New York City, many times those are expensive show tickets or Yankee tickets, Hamilton tickets, expensive coach bags. We can't do those things to have you come to us. We can't induce beneficiaries. The reason for that is the theory is if somebody's coming for the free thing, they may not be going to the right provider. They're going to the provider that gives the free thing, or they may be coming for a service they really don't need because they really want the tickets or whatever it is. So we can't do that in healthcare. And I mentioned exclusion. A lot of people think that you get excluded because you commit Medicare fraud or Medicaid fraud. That's true. You can be excluded for that. But also a revocation of a license sometimes leads to exclusion. Sometimes people lose their license because of a substance use disorder. There are programs in the state that help licensed professionals who are experiencing a substance use disorder in a way where they can surrender their license and get help, and they don't have their license taken away on a permanent basis. But when people do not exercise, those programs, sometimes people do lose their license and get excluded. And we've had that situation. You can get back on the, you can get off the excluded list, but it's a process. So it's a lot of different people that get excluded. It's not just people who go to jail for healthcare fraud. So we are required to maintain contemporaneous records. Contemporaneous records mean a lot of different things to a lot of different people, but what it generally means is close in time. And the reason that you have to have records that are close in time is people realize that our memories are, not perfect. So if I asked you what you had for lunch yesterday, you could probably figure that out. If I asked you what you had, last Wednesday, maybe you remember what you had. I mean, maybe you have, like one of my partners, a peanut butter and jelly sandwich and 2 freshly baked cookies every day, and then it's really easy to remember. But for most people, the longer something is away, the less likely they are to remember. And they know that in healthcare. So they want you to do your documentation quickly. And if it's not considered to be contemporaneous, they start to say, is this really good documentation? So obviously, documentation is very important to us. It's the basis on which we're paid. It supports our quality, the appropriateness, and our billings. Where appearance is poor or in a state of disarray, they get a negative impression, right? They're like, what is going on here? Maybe there's a lot to look at. So they'll look at the number of mistakes when they look at records, and their position always is, if there isn't sufficient supporting documentation, it didn't happen. So we could all know it happened. The individual we were serving knows it happened. We know we used the grant money correctly, but if we don't document it, their position will be, it didn't happen. So when you think about your records, right, how would you view them? Remember, someone outside the organization is looking at them. Obviously, EMR helps us find things a lot easier. But are they current? Are you doing things contemporaneously? If it's paper, is it legible? Not to your mom, to somebody outside the organization. Are they stereotype? If you're doing a note, do you copy the same note over and over and over again? That's not best practice. Cutting and pasting is great in certain circumstances, but sometimes we get sloppy with it where we don't review what we have, and somehow it's not appropriate anymore. I've had providers mention a holiday in the wrong month because they cut, pasted, and didn't read it over. Gotta be careful with those types of things. But also, if you continually cut and paste the same thing, an auditor starts to wonder, is your documentation good? Do you really care about your documentation? Do we really care about the services? Because we're doing the same thing over and over and over again. So they will look at those types of things. If you are using paper, always remember that if a mistake is made, you just cross it out with one line, you sign and date it, and that's to show and provide an explanation for why you're doing it if it's not apparent. That's so that we can show we caught the mistake ourselves, rather than, we caught it right before they came in because we started going through all of our records. We want to show that sometimes we catch things on our own. And so, yes, we did that 2 or 3 years ago, and that's why we date them, so that they know when we caught it on our own. Obviously, make sure we know your signature, especially for those of you who have, scribbles or other things. And then obviously your entire name becomes very important. You should never use whiteout on an official document. You should never scribble over something with dark ink. They should know what's under that. And so you don't want to make them think that we're kind of hiding something under the whiteout. So there are other things that people do with whiteout. We won't get into those, but don't use it in an official record. And remember that when you are filling out something, a form, or our service documentation, if there's a blank, they will consider that to be not complete, not applicable, right? So if you don't put anything in the space, they'll assume that you didn't do the documentation right, not necessarily that you you didn't need to fill it in. So remember, fill in everything. If it's not applicable, put not applicable. Make sure that, where we have table of contents, that's assuming we're supposed to have all of those documents. So we want to make sure that our records look as complete as possible. Obviously, when you date something, always month, day, and year. even if it's really obvious that's in 2023, 5 years ago, or 5 years from now, when they look at our records, they may not know that. And very important, if you are signing something, you always sign it the date, and you date it the date that you sign. You never, ever put a different date next to your signature than the one that you're signing. Backdating is when you wish you had signed 2 weeks ago, but you didn't sign 2 weeks ago, so you put down the date from 2 weeks ago. That can be considered fraud because it makes it look like you are saying that you actually completed something when you didn't, or you signed something when you didn't. And so that is something we never want anyone to do. If you are concerned that you forgot to sign something, something is late, please tell us. We might put an explanation in there. You went out with COVID, or, and you didn't get your documentation in time, or you forgot to sign something. We would rather put an explanation down, have you sign it today, than ever, ever, ever have you be in a situation where you're backdating. Predating is when you are convinced that you know what's going to happen today, so you document before it happens. And that is terribly inappropriate as well, because it's not accurate. But the other thing is I bet if we were able to raise our hands, but you're all watching this separately, but if we were able to raise our hands and I said to you, how many of you have a to-do list for the day? Many of you have a list of things you would like to accomplish in a day, and then we don't get to them all. So, because life happens. So you never want to do your documentation before you do something. You want to make sure that it's totally completed, and then you do it. You obviously document for services that you only provide, and we only bill for the services that we actually provide, where we have appropriate authorization and all of those documents that I talked about. And be careful about times, right? If you're seeing someone and it's definitely PM or it's definitely AM, make sure you get that right, because they will compare HR records to documentation. And if someone is not on the payroll during the time where there's documentation where they allegedly provided a service, then they will say that service should be disallowed. So again, in an EHR setting, right, they're looking for timeliness and volume, and we talked about copying and pasting. Obviously, we track amendments in EHR, so that's very good. We know when we make corrections, and the old document is still in there. Obviously, you only record what you did, not what someone else did. If somebody asked you to do their documentation, no. We would rather the person do it. There are exceptions to that we want to know about. If somebody's out, if somebody goes out on leave, somebody has a baby, then there's things we can do. Somebody leaves the organization, but we want to make sure that we know about those things so we can explain them correctly. And then remember, we can figure out when someone was in the EHR system. So it's all time stamped. We know when people are in and out and how long they're in there and what they look at. It's more of a HIPAA issue sometimes, but remember, need to know basis on records. So our compliance plan starts with our vision, our brand, our principles, but basically we are trying to improve access, quality, and efficiency of care for the safety net patient population in our area. There is a code of conduct that talks about conflict of interest, talks about the importance of truthful and accurate information, talks about our commitment to integrity. And I want to talk just a little bit about conflicts. Conflicts is where there's something in your personal life that may affect your ability to make a good decision in your job. And that's how it's used here. A lot of people think conflict is a bad thing, that it has a negative connotation. It really doesn't. It just means you have a life, which is good. You should have a life. You should have other things outside of your job if that is your desire. But sometimes our worlds collide, right? There are things we're doing on the outside that somehow affect our situation on the inside. And what we really want to make sure is that if there is a conflict, the person who has the conflict is not making the decision, or influencing the decision. And appearance in conflict is very, very important. So sometimes even if the person doesn't help in the decision, we want to make sure that we're able to say that in the event someone thinks they did. So you all have had people who have tried to get a job at the organization probably, and you want to put in a good word for them. There's nothing wrong with that, but we wouldn't want you making the decision on that hire. Or we've had board members who have been conflicted because they've been on 2 different boards trying to accomplish the same thing at the same time. Obviously, using assets of the organization for personal use, right? Obviously, all of the assets of FLPPS or GRIN are to be used for FLPPS or GRIN. Making sure that if you do have outside interest, board interest, ownership, employment in another organization that does business with us, that we know about that. But really, it's about having outside interests that might negatively impact your job performance. And it's all about disclosure. It's not that we can't have people in different roles out in the community. We actually enjoy having people out in the community, but what it comes down to is making sure we know about it. So if there is an issue, we can combat against it. Compliance officers report to the executive director, the board, and FLPPS council. Training, audits, investigation, corrective actions, reporting, all of these things kind of fall under the compliance officer with help from other people, including compliance committee, which is there to provide input and foster that culture of compliance and help with risk areas. Training, thank you for being here. Employees, new employees as part of orientation, an annual update. Looking at our risk areas, I mentioned that earlier. So to the extent that you know of a risk area that we may have, please tell us. Using monitoring tools, I mentioned the OMIG audit protocols, using those so that we can take a look at what we're doing internally. And then obviously, if there are violations, failure to, follow a regulation or documentation doesn't quite meet our standards, confidentiality violations, not following our plan, or retribution or retaliation for good faith reporting. Nobody can be retaliated against for reporting a compliance concern in good faith. That is actually as bad or worse than a compliance violation. Those types of things will be handled appropriately. We will take all kinds of corrective action. Restitution, I mentioned self-disclosure, where we give money back and we tell them why we're doing it. Discipline, training, retraining. We may revise our policies and procedures. We may add certain control structures. And obviously, all of the disciplinary actions against employees, it's a very rare thing, not very common, but it's there and available to us in the event that there is something that needs or requires discipline. Obviously, if you have any compliance concerns whatsoever, you should report to your manager. You can report directly to the executive director. You can report to the compliance officer. You can do it by phone. You can do it by email. You can do it in writing. I always say, do it by carrier pigeon. Have your kid write it out on a napkin. Call with your deep throat voice. Doesn't make a difference. We just want to know. You can make a report anonymously without fear of retaliation, retribution. You can call the compliance hotline. You can do that by mail. We will absolutely get it. There's the hotline number. Understand if you do it anonymously, totally fine, but we can't follow up with you because we are not going to figure out who you are. We're not going to try to figure out. We're not going to look at your handwriting. We're not going to try to see where the letter came from. We're not going to trace a phone call. We're not going to do any of those things. We are only going to investigate. So any concerns you have, it doesn't have to be our documentation or our billing or our contract management, theft, or you have concerns with financial reporting or undocumented transactions or billing, or destruction of records. If we accidentally lose some records or we accidentally destroy some records, I mentioned improper use of assets, violating conflict of interest, or anything that brings you concern, we want to know about. As I said, you cannot be retaliated against for making a good faith report, and failure to report is actually part of the inappropriate activities of the plan. So you're required by your role with the organization to obviously tell us if you have concerns. Compliance is hard, right? Because there's a lot of different rules, and sometimes we feel like the rules conflict. It's hard to follow them all. We know that people will make mistakes. We're human. We're going to make mistakes. People are going to have concerns. People are going to have issues. People are going to have questions. What we want to do is talk about those because that's how we improve. So the most important thing is that we're improving all the time, and that we're always kind of promoting that ethical and compliant culture. So much of what we do is based on our relationships in the community, and we have such positive relationships in the community. We want to be known as that ethical, compliant organization that people want to work with. So please, 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 if you have any concerns ever, make sure that you raise them, talk to someone about them. Your job shouldn't be causing you additional stress. So if you have questions, ask them, because that's what helps us to continuously improve and, work together to support our incredible mission. I want to thank you. It has been, we have been with Flips so since the beginning, since almost the very beginning. A little bit of period of time we weren't, but it has been such a pleasure to do that. If you ever have any questions, I am very accessible, particularly by email. Most people would tell you that. And it's been so nice to be with you today. I want to thank you again for all of your efforts, for all of the good work that you do in your community. And thanks so much and have a good day.